When a doctor tells you or a loved one treatment is needed to feel better, you of course want that treatment.
Well, tonight the I-Team takes us inside a young girl's diagnosis dilemma. It could hamper her mission to walk again.
And she's not just any girl. She's someone who moved us when we met her during the Pope's New York visit. Pei-Sei Cheng has the I-Team exclusive.
When 12-year-old Julia Bruzzese met Pope Francis at Kennedy Airport, she was wheelchair-bound and had little hope of getting better. The Holy Father's blessing was her only consolation. Watch as she fought tears during News 4's live coverage.
It means that he's going to give me a miracle to walk again. I know I will walk again because of him.
And a miracle of sorts did happen, at least in her mind.
Broke my heart.
Back in June, when Julia lost the use of her legs, a few specialists believed she had Lyme disease, but her blood test didn't support that and no treatment was prescribed.
How are you, Miss Julia?
Dr. Ronald Stram, who saw Julia on NBC's coverage, offered to help her.
I knew that she had a suspicious disease that was gone unnoticed or undiagnosed, and I think that Lyme is a very complicated disease and it was one to at least explore.
Julia has been treated for a month and a half now, traveling from her Brooklyn home to Albany, where Dr. Stram's office is located. 3 days a week, she receives antibiotics and nutrients through an IV. She says she's getting better.
I'm starting to feel the bottom of my feet, which is great, and I'm wiggling my toes more, so the miracle is coming, and the Pope brought that to me.
But her treatment might be cut short, caught in the middle of an ongoing controversy. The CDC estimates 300,000 people get Lyme disease a year in America, but there is great disagreement on its diagnosis and treatment. One study shows that in early-stage Lyme disease patients, only 1 in 3 tests will show positive, even if all the patients have been infected.
Numerous doctors. We were in 4 different hospitals, 7 different ER visits, and None of the doctors I saw ever had matching opinions.
Bruzzese's insurance company, Emblem Health, has denied them coverage because her tests have come up negative for Lyme disease. Emblem Health, like most other insurance companies, refer to guidelines established by medical associations, like the Infectious Disease Society of America, to determine when treatment is appropriate. Dr. Gary Wormser of Westchester Medical Center is a lead author of guidelines for treating Lyme.
Patients who've been sick for months invariably will have a positive Lyme test.
Wormser has not studied Julia's case, but stands by the theory that she should have at least a minimum presence of Lyme. Dr. Stram showed us Julia's blood work, which shows some evidence of Lyme, but not enough to be covered. In 2008, Connecticut's Attorney General uncovered serious flaws with the Infectious Diseases Society of America's process for writing Lyme guidelines, saying the panel, quote, improperly ignored or minimized consideration of alternative medical opinion and evidence regarding chronic Lyme disease. The society was ordered to review their guidelines. Lyme disease is often called the great imitator because it can look like so many other diseases, which is the problem Julia faced.
We tested for everything else, spinal taps. You don't know how many MRIs.
When tests didn't point to any specific ailment, doctors suggested psychiatric testing.
It was an emotional time for me and my family, but I stayed strong.
And this is compassionate care. This is about if someone else can offer treatment that can show benefit, we're open. I think anyone would be open. This is a 12-year-old, beautiful young girl that needs to be walking and playing and living a normal life. So you do whatever you can do to make someone better.
Emblem Health did send us a statement telling us after our internal review, a subsequent independent third-party review determined that this treatment is medically inappropriate for this member. They did offer to pay for a PICC line. That's a medical device that will make it easier for Julia to receive IV antibiotics, but the cost of the antibiotics won't be covered, which are more than $500 a week. Chuck.
What a difficult situation with that family. Goodness. Thank you, Pei-Sei. If you have something that the News 4 I team should look into, please give us a call at 1-866-NEWS-244.